someone asked you, what does Joseph, not Dr., Joseph M. Flynn stand for, what would you tell them? Not how they might perceive you, but what do you stand for?
I think compassion, enthusiasm, and respect.
Okay. Is there a difference today in the medical community and in leadership and let's say cancer treatment than there's been in the last 20 or 30 years? I don't mean technology, I mean the patient to doctor relationship. Is that a fair question?
I think it's a great question. I think I would say there is. And healthcare is really complicated now. It's always been complicated,
Sure.
but technically it's complicated, and there's a lot more moving parts. There's how it's changed. Think about it. 2010 was the first year that more physicians were employed by systems than individual practices.
Wow.
Historically, it was all individual practices that made up kind of the fabric of healthcare. So there's been a whole lot of changes in health systems, and I think health systems is a good thing because it brings economy of scale. It also allows people to focus in an area instead of trying to do everything, because I think it's hard to do everything.
Sure.
So yeah, it's much more complex than it ever was. You look and then you even take a step back further. You have academic medicine, community practices. 70%, 75% of drug discovery now is happening in the community at big health systems. So
Wow.
it's much, much different.